my name is Dr. Jeanette Witt with the Witt Physical Therapy and Wellness. My practice serves the Kenosha, Racine, and surrounding communities in southeastern Wisconsin. If you are beginning an exercise program, please consult your local physical therapist or contact my office to schedule a health and wellness evaluation. This will help determine your baseline strength and flexibility for beginning exercises. To contact my office, please visit www.dewittphysicaltherapyandwellness.com. The purpose of this video is to provide you with exercises to help prevent patellofemoral syndrome. It is very important for your quadriceps muscles and your gluteal muscles to be strong so that your hip and your knee joints have stability. When you have weakness in these two muscular areas, sometimes the knee cap will not track properly in its groove and will be malaligned. One of the first exercises that you can do is a basic squat. A squat position should begin with your feet shoulder width apart. You want to flex at the hips and the knees and sit back like you're sitting in a chair. Your knees should be in line with your second toe. And if you cannot see your toes, then your knees are too far forward over your feet. From a side position, it should look like this. Again, you're sitting back like you're sitting into a chair. The next exercise that you can do is more advanced, so you definitely need to master the seated squat first. But you can also perform a squat jump. It is important to jump and land with your knees flexed. Again, your knees should be in line with your second toe and in a squat position. So the squat jump looks like that from the front angle. And from the side angle, it looks like this. One of the next exercises will help support the hip is the standing hip abduction. You stand and bring your leg out to the side. You can also repeat on the other side. By performing in a standing position, it not only strengthens your hips, but also helps with balance. Hip abduction can also be performed in a sideline position. When performed in sideline, it is important to straighten your leg and raise, keeping your ankle, your hip, and your shoulder in a straight line. Also in the sideline position, you can perform a clamshell exercise to strengthen your external rotators of the hip. So you're keeping your knee bent and raising the knee up towards the ceiling. These exercises then would also be performed on the opposite side. The sideline hip abduction with ankle, hip, and shoulder in a straight line, and the clamshell with knees bent and the knee being raised towards the ceiling. The clamshell exercise can be advanced by using an elastic tubing around the knees to provide extra resistance. And one final exercise that is also more advanced is the standing single leg squat. You may need to use the wall for support. Very similar to the initial squat that we performed, but this time performed with a single leg. You can also perform this squat on the opposite leg. The key with all of these exercises, the standing squat, the single leg squat, and the jump squat especially, is keeping your knees in line with the second toe. This helps promote good hip-knee ratio stability. I hope these exercises are beneficial for you. If you do have pain performing any of these exercises, please contact your local physical therapy office. Thank you very much, and have a great day.